This panel was recorded during the 15th Annual Public Administration Research Conference, March 19th, 2021. The panel is titled, Response and Recovery to COVID-19, an Emergency Management Panel. It is moderated by Ms. Margaret Hart, the Emergency Management Advisory Board Vice Chair.
Thanks to our three guests that are here today, with the exclusion of Deborah and Dr. Knox. Really glad that we have you here in the audience, and I think we'll have a great discussion, and I think this will actually benefit you in the end because there will be more opportunity for open discussion and questions. So again, thanks for your time and joining us. So I'm Margaret Hart. For those of you who don't know me, I am the Vice Chair of UCF Emergency Management and Homeland Security Advisory Board. The advisory board serves the university, providing programmatic guidance and supporting the students and of the faculty and staff who are preparing the next generation of emergency managers. So joining me today on the panel, we have three wonderful speakers. The first is Reverend Mary Downey. She is the CEO of the Hope Partnership. Eric Alberts, Corporate Director of Emergency Preparedness at Orlando Health. And Alan Harris, Chief Administrator with the Seminole County Office of Emergency Management. So please join me in welcoming these three. My goal today is to guide a conversation related to public service during difficult times. I hope in our panel today that we can highlight some of the accomplishments and the solutions, many of which were born from this group moving forward in the pandemic. And most importantly, how we can do so with the purpose of improving our society in an inclusive and socially just way. So I'm going to turn it over to Reverend Downey first. If you would like to introduce yourself further, tell us a little bit more about your organization and who you serve.
Yes, good afternoon. So I am the CEO and founder of an organization called Hope Partnership, formerly known as Community Hope Center in Osceola County. We work with families and individuals who are experiencing poverty and homelessness around Central Florida. So that could be anybody who is living doubled up in their cars, families in motels and hotels, or people who are living in tents and other places that we would call unfit for habitation. Our organization provides support services around those individuals and families, as well as works towards future housing opportunities for them. And I'm very thankful to be here. I'm also a deacon in the United Methodist Church.
Thank you, Mary. All right, Eric, Mr. Alberts. How about you?
Hi, everybody. My name is Eric Alberts. I'm the Corporate Director of Emergency Preparedness for Orlando Health, Inc., which is a healthcare system based out of Orlando, Florida here. And for my role, I cover all of Orlando Health except for Bayfront and the St. Pete area. So that includes 9 hospitals, 2 of which are level 1 trauma centers, 4 freestanding emergency departments, 3 medical helicopters, tons of outlier buildings, and about 20,000 employees. And I do emergency management and I do homeland security type efforts for the hospital system.
Thank you. And last but not least, Mr. Harris.
I'm Alan Harris. I'm the Director of Emergency Management for Seminole County Government. Seminole County, I serve approximately 500,000 residents here in our county with 7 cities. My responsibility includes, of course, preparedness, response, recovery, mitigation from any type of hazard. Of course, the hazard we'll probably be talking about most today is the pandemic, but certainly other hazards as well.
Thank you. All right, so let's get started. Our first question, Eric, this one's going to come to you first. Was there a pandemic plan in place for your organization? If so, did you find that it prepared you adequately for COVID-19?
Yeah, that's a good question. So we had and still have a pandemic preparedness and response plan. And that really helps us with how we will respond to a pandemic, especially being a staffing models for surge situations inside hospitals and many other things. So we did use those components throughout COVID. Obviously, when we put the plan together and maintained it all these years, it was based on learnings from books and, from lessons learned from other situations. Having gone through a real situation like this, you learn a lot. So from that, we've actually already updated that plan and it's been approved internally. We also now have a COVID-19 playbook that we're doing. So if we have a situation like this for a respiratory virus, we are able to pull this 200 and some page document out and reference it so we know exactly what we've done. And in hopes that we'd also be able to share that with other hospitals. And we also have updated our alternate care site plans. So if we've got to set up like a field hospital, we had learnings from our drill that we did, so to speak, where we set one up outside of ORMC for over a month. And we learned a lot from that. So we've enhanced the plan with that. So just like everybody else, we've had to adjust and modify as necessary going through this.
And so I'll go ahead and follow up with you. What would you say one of the biggest challenges was, aside from no previous examples, at least in recent history, that any of us were here for?
Yeah, so for us in the hospitals, there were a lot of issues that occurred for us, a lot of challenges, huge ones. So PPE supplies were obviously a huge issue for us. You heard about that across the United States, but it really hit the hospitals hard. And because of that, there were a lot of staff concerns and problems that resulted from that. So we had to go through a lot of extra lengths to work with our county counterparts to try and get a lot of supplies. Oddly enough, one of our main vendors that we get N95 masks from, respirators, at least back when all this started, was from Wuhan, China. So it's just hard to believe that where it all started is where we ended up getting some of our N95s from. So it just caused a lot of problems all over the United States, with a lot of the main manufacturers being in China, where the heart of this all began, and then we're in lockdown. So we had that. We had a lot of staff concern. And then we had a lot of varying governmental requirements that we had to fulfill, both in reporting and also in protocols. So, a lot of those things created issues for us, where we had to look at all of them and say, which ones are we really going to do or have to do, and which one's right for us. So some of them we went above and beyond what the protocols were, because it was the right thing to do for our staff.
Thank you. All right, Alan, I will turn it over to you. Same question. How was your pandemic plan, the one you had in place? And if so, did it adequately prepare you for COVID-19?
So yeah, the county does have a pandemic plan as part of our comprehensive emergency management plan. It is reviewed every year. We conduct exercises on the pandemic. We always choose the event of the year, the event that is occurring. We have, of course, dealt with H1N1, swine flu, the Zika virus, Ebola. So most of those have been relatively well-known viruses. So did it prepare us for COVID? Not necessarily, because COVID was novel. We didn't know much about COVID. Things changed during the event. We learned about the science of COVID. At first, it was don't wear masks. Then it was do wear masks. And then you can't even get a test, and then you can test, but this test does this, and this test could have false positives. So there's a lot involved with that. I would call our pandemic plan more guidelines than a plan itself. It did provide a framework for how we responded. We always knew from the previous exercises, the plan itself, that we would have a well check unit. That well check unit, sometimes called contact tracing, would check on those individuals every single day. That, of course, worked for a while until the numbers grew so much that we couldn't do so. So we were doing it maybe every 2 or 3 days. We always had a plan for providing food services to individuals that were isolated and quarantined in their home. And we continued that service with the partnerships. And that's why it was very important for us to have the plan. Our partnerships with nonprofit organizations that provided us food, Harvest Time International, the Sharing Center, Second Harvest Food Bank, and those types of establishments, and also sometimes shirts and clothes and sheets and things, because people needed that. They couldn't otherwise risk infecting the rest of the population. We did have, of course, in our plan, the concept of PPE, so again, a guideline, but nowhere did we think that, in no scenario did we think that hospitals would be asking for PPE, living facilities or nursing homes or just the general public. So that plan had to be adjusted to deliver thousands of packages of, now we're in hundreds of thousands of packages of gowns and gloves and facial masks and coverings and things like that to hospitals and nursing homes and assisted living facilities and all types of institutions and even businesses, some of our governmental businesses. So that changed. Testing was not necessarily in our plan. Vaccine was. So we had done vaccine. We had done H1N1, so we had a pretty good concept of what that would look like. We already had MOUs set up as part of our plan. So we had a pretty good guideline as far as that goes. But did the plan itself, I think that it's a living document, and we used it that way. We used it as a nice framework, and it worked pretty well.
So I think you presented a good segue. You mentioned working with community partners and really leveraging that whole community relationship that you developed ahead of time. And I think that's where organizations like Reverend Downey's come into play. So for an organization that may or may not have had a pandemic plan, how did you rise to meet the challenge of COVID-19?
Yeah, so we did not have a pandemic plan. We had participated once in a Osceola County pandemic, simulation that they had in the past. So we knew it could happen, I guess. But we knew, I think, first off, that we needed to look at what we knew already, and that was, how do we respond to other emergencies when you're dealing with people who are unsheltered and unhoused? And so we really began to kind of processing what that looks like. Really, as we were learning more and more about the virus, we really recognized that we had some really, really places of just could be catastrophic if we didn't address them quickly. And so we went into, just kind of planning mode with our emergency management, talking a lot about non-congregate shelters and how we can get people who are exposed to the virus into a place that's safe for them so it doesn't spread to camps or across hotels and motels. I think the other thing, though, that for us that was just a challenge and difficult for us is the same thing that everyone else was experiencing is the lack of PPP for my team, or the PPE, or for my team. I get the three little P's confused all the time there. But not having that for my team and not being able to protect them properly, and then also not being able to protect the people that we were serving properly. We weren't classified as medical. We weren't classified as essential in many ways. And yet we had thousands upon thousands of people pouring into our building and our property, looking for food assistance, looking for shelter, looking for opportunities for care. And, we had a staff of about 6 who were able to respond because we had people on our own team that we had to make sure that we were protecting. And so really my at that point early on, my early millennials and my Gen Zs really kind of took on the blunt of a lot of work, because it was looking like, well, they were the ones that are going to get the least sick. And so we really had to just do things that we never thought we were going to have to do before. And in the mix of all that, making sure that we were continuing, we had weekly calls with our emergency management, making sure that we were connecting with everyone in our community to see what was going through kind of from the county level, so that we could make sure that we were properly prepared to the best of our ability. It has been really a wild experience for us on the nonprofit side.
Thank you for sharing. So moving on to the next question, a central theme of 2020 was the spread of misinformation and divisiveness, much of which we saw a lot of, especially early on in the pandemic and even now. So how did you see that impacting your efforts to respond to COVID-19, and how did your organization respond to that? I'll start with you, Mr. Harris.
I'll start locally and then I'll move up. So locally, we did very well. I have a leadership team that is extremely supportive of what we do here in the county, and I think that benefited me greatly. I can see across the state of Florida where that occurred and where that did not occur. Where it did not occur, you're seeing a very big shift in emergency management directors and positions. There are a lot of available positions right now because people have fled the discipline. And it's because that I believe it is because that it became so political. A public health crisis became so political that some people couldn't make it through. Luckily, I was really blessed with an amazing leadership team, an amazing electorate in my county that was supportive of public health, understood the science, and even though it wasn't necessarily favored by everyone in the community, most of the community understood what was going on and understood the protective measures that we were trying to take. When it gets to the higher levels of government, I think that it's very easy for us. I mean, anyone that watched the news, there was a lot of misinformation, a lot of information that was scientific coming from the White House medical team, people like Dr. Fauci and those types of folks. And then there was folks on the political spectrum that was simply saying that it's going to go away, that it's not much to worry about. In a few months, this is all going to be gone. And people thought, well, they're probably right. And in fact, even today, people in the state of Florida are wondering, and I mean, officials are wondering, why aren't people coming back for their second dose of the vaccine? What is going on? Why is that occurring? Well, if you remember, about 2 or 3 months ago, our senior leadership was saying, and I'm not talking about the county leadership, I'm talking about state and federal leadership, was saying, really, all you really need is 1 dose. And that's good enough. Well, people hear that and they say, well, this is a senior leader. This is an elected official. All right, I'm just going to take the 1 dose and so we're seeing that. We're seeing that across the state of Florida. People got their first dose and they're not coming back for their second dose. And that's part of it. And for some reason, social distancing and facial masking and coverings became a political stance. Now, some people, even on both sides of the political aisle, understood the science and are following the science. And then there are those that simply do not, and you can see it. You could see it. I think that if I just as a personal thought, if there was a best time for a pandemic, it was not during an election year. But unfortunately, this was during an election year. And it became not only political, but it became an electorative campaign. And unfortunately, we've seen the repercussions. The repercussions are people fleeing the discipline, have left their jobs. And now, as we do with most disasters, you're seeing some very interesting bills that are up for discussion. That could be very detrimental to the state of Florida, and it'll be very interesting to watch how things change in our state and what emergency managers and the emergency management discipline, how it survives this particular disaster.
Reverend Downey, how did you see that information? Was it in your organization or even in the people that were coming to find services?
Yeah, I'm going to talk about this actually from both my organizational standpoint and the church standpoint, because I think people actually don't have a strong realization of how much the divisiveness affected churches and how difficult that has been for our church community and our nonprofit communities, because we work so closely with our churches. I mean, obviously, I'm a pastor, so I'm working in a local church as well as leading an organization. And most of my volunteers are coming from local churches. And so when you have churches that have taken different theological stances on mask wearing, which to me, I can't even just say, like saying that out loud still is baffling to me, but is exactly what has happened. It was very difficult for us to engage our volunteers in a way that kept our team healthy. and kept our team safe. And so we of course leaned very heavily towards whatever science we could find, and we lost parishioners in our churches who refused to wear masks, and we lost volunteers in our organization who refused to mask, who refused to socially distance. I remember having a volunteer scream at me because she said that I claimed that I thought she was dirty. And I was just like, no, this isn't how this virus works. It's not about you at all. It's just about the fact that we don't know enough not to make sure that everyone is absolutely masked all the time. And so it was just really, really difficult to help our volunteers who maybe were hearing that divisiveness and wrong information, in my opinion. And I think everyone agrees, in my opinion, that it was the wrong information about what we should be doing to protect ourselves. But also just trying to pastorally care for people and to help them understand that by wearing a mask, we're living our neighbors well, and trying to help people to see that even if we're wrong, even if the science is wrong, what does it harm to take the extra step to care for someone else in our community in this way? And I actually am still seeing that. I have people who are refusing the vaccine. I have volunteers who, we're kind of trying to figure out as an organization, do we require vaccines when we know that we are working with such a vulnerable population and that this virus could just completely devastate a whole community of people who are experiencing homelessness, and trying to figure out where we stand on something like that. And so it continues to be something that we're dealing with.
And last but not least, Mr. Alberts, how are you seeing this from the Orlando Health side?
Well, all throughout this situation, there's been a lot of misinformation, divisiveness that's occurred everywhere. And when you're in the hospital, the epicenter of a lot of this stuff, where you're caring for the most critically ill, you get a lot of misinformation, misunderstanding. When you have misinformation, you get the misunderstanding. And it's just like perpetual wheel where it just kind of goes around and around. So really, for us, you got to dig deep to find out the real true information, and not someone's hearsay, thoughts, or rumors. And there's so much of that out there, but you have to dig deep to find the real true stuff. You've got to create your own filter to identify what's real and what's not. And then you got to stay away from what's not. And you got to be very cautious about how you're communicating with others, especially with those outside your organization. So, that's really what it all came down to for us. And I don't need to say this for Allen, but in general, we got pounded for information from the counties, but the hospitals are really reticent to disclose a lot of the information because of a lot of different factors. Misinformation. What is the other side going to do with it? What official report is it going to end up in? How are people going to view this when it's not really the right way of viewing it? So you got to stick to what's required of you and reporting the data. So that's what a lot of it comes back to, is sticking to exactly what's required and not beyond that, because there's just so many issues with going beyond that. And it's all this stuff that we're talking about, the misinformation, the misunderstanding, the divisiveness. So it's very problematic, and it was painful. A lot of times it's very painful because a lot of people needed data, but there's only so much we could give because of politics and misunderstandings. And it's kind of hard to explain on this call, but there was so much to that.
I appreciate all of your responses on that question. I know that, we're still dealing with an ongoing event. We're not out of the woods quite yet. And this is an ongoing live incident and response still. So thank you. And so I'm going to go ahead and move on to the next question and begin to touch on some of the inequality and inclusion themes that we're bringing forward in our panel this year. So we faced more than just the pandemic and more than just disparity and misinformation. We also came face to face with the systemic racism in our country. We saw citizen violence against one another. And as a result, the movement for inclusive justice grew louder, and we can no longer ignore it in our roles as professionals, as emergency managers, as public servants in each of our own capacities. So how would you say this has impacted your leadership and, where applicable, even your organization's response to COVID-19? Reverend Downey, I'm going to start with you.
So our organization has always been, as much as we can be, an inclusive organization that's run by a white woman. And so we try to be as relevant as we can in those conversations. I think that this summer forced us to be louder about those things, forced us to really start paying attention and saying the things that maybe underlining we've always known to be true, but we were afraid politically that organization could suffer damage if we continued to talk about it, that we would be seen as too political, or we'd be seen as too far out there. And we just kind of decided, I think probably in July, that we didn't care. Right is right, and there are great injustices happening in our community, and our job as people who are representing those who are experiencing homelessness and poverty, and how the overlap between those things are directly connected to racism historically in this country, we can no longer ignore. And so we started to be more vocal about that. Again, I think we always kind of knew it, but we just didn't say it out loud because we were afraid of what the ramifications could be. And some of those things are not great things for our community to hear. It's not great to think about the fact that 60% of the people I serve are people of color, and that they all are in low-wage jobs along our corridor. And we have not, for the last 50 years, built any housing to accommodate people who are in that space. And it's very hard for you to tell me that just has to do with, their wages. It's very hard for me to believe that at this point. And so we have just been willing to say those things out loud and believe that we as a community have to start reckoning with things that are uncomfortable. I think that I have watched the same thing happen in my denomination as a church, began to speaking the things out loud that some people have been saying and banging drums for a very long time. And yet no one has really been listening, but starting to watch leadership listen, start to watch people start to pay attention and continue to need to pay attention. I mean, we had an attack 2 days ago on people of Asian descent. And we have some people saying, well, that's not racially motivated. Everything is racially motivated at this point, and it's really difficult for us not to look at it that way. Again, we know that when we say things like that, when we make generalizations, people want to respond in some kind of way. But really, when that response kind of wells up, that's where the questions really start to be asked. And so we are willing to engage in those conversations and willing to help our community be stronger because of it.
Thank you, Reverend Downey. Mr. Alberts, is there anything to add from your perspective working in the healthcare system and public health?
Yeah, so our plans, our efforts amongst our department here, but also for Orlando Health and the way they operate as hospitals, is really all hazards and all people based. And I have to tell you, I've never seen more caring people as the clinicians and those that are working in the hospital day in and day out. And they just don't care. When a patient comes in, they're a patient irregardless of what or who they are. And that's, to me, it's just so admirable. And I love seeing that and being part of that. And I just have to say that, all the efforts have got to be fair, balanced, but responsible, especially with communications. And when you think about like protests and riots and all those things that happen, we have to be prepared for those situations. And we've got to protect our facilities and our staff and our patients as well. And, being all hazards, all people, that's great in the way we operate, but things happen and they happen around you and they impact you. So, going back to that fair, balanced, and responsible, we found out about protests. We had to communicate that with our key staff that really needed that information. But the message is really got to be geared towards like situational awareness and not seen or viewed as any one side of things. So you've got to be very honest about or realistic about what could happen as opposed to who is protesting and all those types of things, if that makes sense. So very generic in one regard, but specific on another, especially with riot control agents and all that, and how we would decontaminate patients and treat them if they came into the hospitals. And really just reminding everybody that you're going to leave politics out of it. So especially amongst the staff and all those communications, when we're communicating with our staff, no politics at all. It's just, this could happen. This is what we're aware of. This is what we are being told. And here's how to be prepared in case somebody comes in the hospital. So just a preparedness and situational awareness based So that way our staff are ready and comfortable in dealing with those situations.
I can actually speak to that firsthand, having seen how you handled the events of last summer. I was actually in Winnie Palmer having my son the week of the riots, and we heard a lot from the staff. And in the back of my mind, I said, I know who's behind those communications and working with everybody here at the hospital right now. So thank you for doing that. And as you said too before, Mr. Alberts, you really are the epicenter of most critically impacted patients during the pandemic. And you have to do what you can to treat everyone who walks in, no matter their race, creed, origin, ethnicity. And it's certainly a position to be in.
Yeah, I mean, we realize we've got to be there for whoever needs us whenever they need us. So that's the hard thing about healthcare. And when you're put in a real pinch with not having enough PPE supplies or pharmaceuticals or therapies to treat folks, so you just have to keep plugging away and trying to help care for them. And that's really problematic at times. The staff, in a lot of regards, are really worn down and exhausted in a lot of regards, especially mentally. But you've got to do a lot of resiliency efforts to help them and show them you care. And the hospital has done a lot of great efforts to show them that they do matter and they do care. And part of all this difficultness of the situation we're in is not only trying to be there, but then you also get threats from a lot of people. So I've been having to deal with threats through social media and phone calls and all kind of stuff. People want to drive vehicles into hospitals because they're upset about how they're not able to get their loved ones because of COVID-19 and all this other stuff. And it's just been relentless on threats. And, so you got to follow up with law enforcement and Homeland Security or FBI and all those kind of folks. So it's not just that, it's all these other threats and issues that are going on that makes it more problematic.
Mr. Harris, same question to you. How is incorporating equality and inclusion in your role as a leader and your leadership style, and to what degree with your response to COVID-19?
Well, unfortunately, Seminole County has a little bit of experience with issues related to diversity with the Trayvon Martin incident, the protests and rallies, George Zimmerman trial that fell after that, which, of course, eventually launched the Black Lives Matter movement. So we are we're very familiar with this. We came in to COVID with the understanding that we needed to make sure that we reached all segments of our population. So while we did have, and this just goes to every aspect of it, our well check unit wanted to make certain that we had there was no language barriers whatsoever. So we always had individuals in our well check unit, our call center, that could speak multiple languages. We also wanted to make sure as soon as testing was available that it was not just at a drive-through site, but it was actually in predominantly African-American communities and other communities that we needed to get into, transportation disadvantaged communities, to make sure that they all had equal access to testing. Our vaccination plan always had included getting into low fixed income, transportation disadvantaged. We added, of course, senior communities because COVID, as we learned more, was targeting seniors at a higher rate, if you will, for fatalities. So we had already planned to go into low and fixed transportation disadvantaged communities, but we also added to that senior communities to make sure that they were well served, as well as language barriers. I think we are I'm pretty sure that we are the only county in the state of Florida that has been to every faith. We have been to a Hindu temple, a Jewish temple, a mosque, multitudes of Christian churches, Latter-day Saint meeting house, a Sikh temple, every faith that is in Seminole County, we have been in their facility providing vaccine. We have provided vaccine in every low and fixed income community in Seminole County. We have had a language barrier vaccine points of dispensing where it was all Spanish-speaking pod. So that everybody felt comfortable. Everybody could easily access vaccine in the place that they fellowship and with friends that they are comfortable with. We wanted to make sure that it was safe, it was comfortable for them, and that they could get access to it. That was always our plan, and it has been instituted pretty well. We are planning now even more as the age brackets grow to make sure that every segment of our community, not just the rich sections of the community, but every section of the community has full and equal access to every response technique or mitigation activity that we can provide. We provided facial masking coverings to those that along with food lunches. So people that are on free and fixed income, free lunches with the school system. We provided PPE at that location where they can come by and get their lunch and some PPE as well for their family. So we've really tried to make it a diverse, equal access community in Seminole County. We've done pretty well. Could we do better? Sure. And we're always looking at ways that we can improve.
Thank you. Seminole County has definitely led that effort, and I appreciate you being here today to speak specifically to that. So our next question, moving towards the light at the end of the tunnel, with the continued rollout of the COVID-19 vaccine, there seems to be cautious optimism that that's where we're headed, that the end is in sight. However, this doesn't mean that there won't be aftershocks as the public health and our economy continues to recover. How did 2020 change your profession in emergency management? And what are the takeaways you hope to carry with you moving forward? Put myself on mute too early. We'll go back to you, Mr. Harris, to respond to this question first.
So how did it change emergency management? I think it changed every aspect of emergency management, quite frankly. From the leadership of multitudes of counties, now people have left the field. People have moved to different segments of emergency management, privatizing emergency management in some areas. There will be new laws and statutes developed after this. Some good, some very important, and some the bills that are being suggested could challenge us when we respond to hurricanes. So changing things because of a pandemic may provide challenges later on when there's a hurricane and you have to act quickly. We have learned from this, certainly. So I know that we're going to make some changes throughout the community. My profession, those that could retire have retired already or are planning it very quickly. I have never, in 20 now years of emergency management, had personal threats to me and my family. I've never had anyone tell me that they were going to kill me. I've never had police cars in front of my house before. All of that occurred during COVID-19 because of facial mask and coverings and because of social distancing. The way my county currently is when we have a local state of emergency, the director of emergency management signs the executive orders. So it was my job to sign executive orders related to social distancing and mask. And unfortunately, that did provide stress to my family and myself. So it has changed my whole perspective of emergency management from my associates and friends fleeing the emergency management field to personally, having to deal with threats to my family, and of course having to deal with the family. Of course, them having to deal with something related to my work. And we've had actually discussions at my house that maybe this is the time to exit the profession and actually do something different. And so, I mean, there's been talks of that. I love what I do. I love the difference I make in the community, but it is very, very difficult. And if any student is watching this later, I would just say, I hope this doesn't scare anyone, but certainly it's something to think about when you get into the profession, that you can make a major difference, but there are going to be struggles. And while I don't think that, I pray that there's never a political crisis like that, there's always some politics, even in hurricanes. You're not picking up the garbage fast enough. You're not doing this or that quick enough. Well, you shouldn't have issued a curfew. You shouldn't have issued the burn ban. People need to burn their trash in the backyard and little things like that. Nothing to the level of what this has brought. So that's my take on emergency management. I'm sorry to be a downer on that one, but it is a realistic what is occurring right now. And I mean, you look across the state, and there are multiple director positions open right now across the counties.
Reverend Downey, how are things for you and with the Hope Partnership as we move towards recovery? What are some of the takeaways that you want to remember and learn from going forward?
Yeah, I honestly, as weird as it may sound, much of the things that Mr. Harris mentioned are the same thing that nonprofit leaders and church leaders have also dealt with during the pandemic. Threats to, maybe not physical threats, but definitely threats about your leadership, threats about where your allegiance lie. Are you a political organization? We got that one on social media a few times. Just the amount of misinformation, again, it does go back to that was kind of rampant, and trying to continue to be a voice of reason, and to do so evenly without, the passion that normally I have as a person was something for me, a learning curve for me. Poor Margaret was in many meetings with me where I did not actually do that very well because I believe in caring for people over anything else. And so sometimes that was a learning curve for me that I needed to back off if I wanted people to actually listen. And just the frustration that brought, so much politics, so much more in ways that I never expected, not just the big ticket things that we're thinking about, but little things about counties working together and the ways that there were solutions to problems that would be made easier if one person would just budge on a decision, but there was some political undermining that happened. And so we were not able to serve our community in an efficient way because of those types of conversations. And so those were some things that just kind of opened, I think I knew were there, but really kind of opened my eyes to what was happening. I think one positive that I will say is I believe and I hope that it will continue to maintain that the people that we serve as an organization, people recognize them as essential. And I think there may have been, and I hope it continues, more respect for people who work in the tourism industry, who are your grocery workers, who are in your hospitality industry. Those people are what make our community actually work. And so I hope that our broader Central Florida community will pay attention to those folks as we think about proper ways to give them housing in the long term and how they should be cared for. And we will remember that it was those people who were making sure that our whole community was taken care of while other people were on lockdown. And so that's a takeaway that I hope that will continue. And I just want to say, like, from the ministry side, I think that we learned a lot about discipleship in the church and what that actually looks like and how to disciple people through a pandemic and what that looks like also from a clergy standpoint and the amount of burnout and difficult side of that has been for many of our team just within the clergy side. So it has not been easy. I don't think I think every single industry could talk about how this pandemic has been incredibly difficult. And so, Mr. Harris, you said, if any students are watching, I think the one thing that our organization does well that I would encourage every single organization to make a priority is self-care for your employees and making sure that they're taking care of themselves and getting what they need so that the ramifications are not devastating.
Thank you. And Mr. Alberts, as you move towards recovery, what does that look like for Orlando Health and for you moving forward? And again, as an emergency manager, what are the takeaways you want to take with you from COVID?
Yeah, COVID-19 really changed the world. When you think about it, and inherently it changed the way we do business, especially in emergency management and healthcare and social distancing, masking, all the concerns that floated out there, the misunderstandings, miscommunications. So really, had to go back to the drawing board on a lot of stuff and reinvent the way we do things. And you're probably going to hear that a lot throughout emergency management these days. And you're going to look at what we do and how we can do it, optimize learnings and opportunities. And, we've even talking about like virtual offerings or virtual efforts in person when necessary or when you can. And then even with exercises and real incidents, it's the same thing. Go when you really have to, but otherwise stay out of it because you want to try and protect yourself so you can protect other people in the long run. So it's just a whole different way and dynamic of doing things. And at the end of the day, it's all about flexibility, being very flexible because it seems like every day you're trying to change and morph or grow. And resiliency are the two main key words that I really kind of hit at. And, as the other speaker said, for me, if you're a student, I don't want to scare anybody either, but you've really got to be good with stress. I mean, this profession, this job is so daggone stressful, and I really mean that. It's nonstop. Even when you're off, you're not off. My staff, I got a really good staff here, and we instituted a on-call duty officer. So every week somebody shifts that rotation. And me being the director, I'm the only leader, so to speak, with the position level in the department. So if something bad happens, I'm going to have to be notified anyways. And the other folks don't know about the senior officials or senior executives don't know about that on-call piece, even though you can tell them 300 times. So they still call you. So in the middle of the night, late at night or early morning, sometimes it's dumb things, but you end up having to deal with it. And sometimes you have nothing to do with it. And that's what emergency management is all about. Yes, ma'am. Yes, sir. We'll try and figure it out. We'll get it fixed. And in the back of your head, you're scratching, you want to scratch your head and say, what the heck? Why did I get that call? It has nothing to do with me, but that's what's expected. So you got to be okay with that. You got to be able to handle the stress, being called out on the carpet when you have nothing to do with it. But still, there's a lot of things you can do. There's so much you can do to make things better. When something bad happens and people see that you help them through this, it really touches you and makes you want to come back to it and do it again the next day. So, sometimes you got to realize too, the community depends on you. So as bad as it is, and as bad as the situation is, or the stress about the situation, you don't want to go and deal with it. You have to, because you realize that there's other people that are depending on you to do it, even if they don't show you the respect, because this job, unfortunately, you don't get much appreciation or respect. I'm sorry, but you really don't. Most times you don't. So you've got to understand there's a deeper purpose in doing this and waking up every day and coming in and doing it when there's no thanks or appreciation or applause behind it. And not that you expect that, but sometimes it's nice to hear that because it does motivate you to keep doing that. So as a leader in this field, you have to do that for your staff. And that's what I've learned. It's really tough on them. They're seeing all this bad stuff that's happening, but you have to show that respect, appreciation, and admiration for them and what they do because they're helping you through the process. So it's really hard as a leader in emergency management because you're dealt with so much, whether it's your staff, the situation, the community, the stress, the misunderstanding, but you just got to step up and try and beat it and show the others that you're strong enough to withstand it so that they can be strong enough and withstand it as well. So I don't know if that resonates with anybody, but that's kind of how I felt.
And I think that we can tie really our entire discussion here back together to the fact that, it takes all of us to respond. It takes all of us to recover, to take care of one another. And, while many of us here know one another, it's not just from, volunteering or serving on the advisory board with UCF. These relationships were forged prior to COVID. And to the students who are listening, to those who are interested in the research or here attending the conference for other reasons, understanding that in emergency management, it's all about partnerships and leveraging the knowledge and the expertise of others. As emergency managers, we come in, I guess you could say that you're the ringleader of a three-ring circus sometimes. You're not the expert in public health or epidemiology or, but we turn to those emergency managers to bring all of the participants to the table that have that subject matter expertise. And it is exhausting and it is a lot of work to know not only who to bring, but what needs to be done, and to really kind of manage the project and see it through. And I certainly hope, and I know with this group, it's the truth, we'll continue to maintain these relationships moving forward, whether it's a hurricane or, wouldn't it be nice to get back to battles about whether or not there needs to be a burn ban? So we've reached the end of our scripted questions, but I really want to take this opportunity with such an intimate group to allow for open conversation and audience questions. Dr. Knox, I see you asked some already and that Mr. Harris is able to respond, but I'd really like to open the floor to first our participants and see if you have any questions of our panelists today. Dr. Knox, I see you have your hand raised, so I'll go to you first.
Thank you. I have so many questions, but I will each of you guys individually. An amazing panel. I am very, very excited to share it with our students. I will narrow my question down to one, and I think probably Mr. Harris will be best to answer this question. But, some of the lessons learned coming from the Hurricane Irma experience was of controlling communication, that there's a number of ways to communicate with our public. And when you narrow that conversation down to just social media, we know that counties have multiple accounts. And so I was really curious if you can talk to us a little bit about how your county decided, specifically to social media, which accounts they were going to send information to, and did you try to narrow it down to one or prioritize? That'd be great.
So, we totally have shifted around on social media. I would take 15 hurricanes over the pandemic. So I think our plan is eventually to get back to where we were. And I think, I know that our social media plan is going to be different based on the disaster. So our social media plan was to do regular Facebook Lives, was to regularly post messages about what was going on and provide the public with information about the disaster, mitigation efforts, things like that. That went very well at the very beginning of the pandemic. We did Facebook Lives, we did YouTubes, we did social media, we did press conferences, all the things that we normally do. The Facebook Live, about halfway through the response, became more of a complaint and threat than a general question. It wasn't people wanting information anymore. It was people threatening and unfortunately, it was the public information officers that were responding to these sometimes just vile messages on social media. So we decided that we were going to change our policy and we were going to provide information. We were not going to provide the Facebook Lives anymore. We canceled that pretty quickly after the first spike. People had very different opinions of what the counties should do. Either go back to normal life. This is just like the flu. Some people thought that. And then the other aspect, there's been various levels. So this is just the flu. This is going away. Nothing is going to occur. Even today, this is nothing more than the flu. You should just forget it. And then there's a large segment of the population that is relatively quiet that I think understands the science, that really is like, yeah, you know what, I can put on this thing and it's okay. And you know what, I can actually make it through the grocery store fine and everything's going to be okay. And we're going to get through it. And then there's the other side, which is scared to death, that's so scared that they don't want to go anywhere. And we don't want to panic those people. And also we saw the Facebook Live, while they had a lot of negative comments from these people that think it's just the flu. On the other side, sometimes providing so much information is scaring the death out of these other people that shouldn't be this scared, and maybe we're providing too much, So we tried to balance it, and we provide now a dashboard where people can see what's going on in the county. We provide 3 times a week kind of a snapshot of what's occurring. And then if there's some kind of special activity, we may do a post. We utilize multiple platforms. So we may use a Nextdoor if we're trying to reach a specific community. Or we may do Facebook if we're doing a community-wide type of announcement. But we have totally changed how we do social media. Press conferences were adjusted as well. And for some locations, the press conferences worked real well. For Orange County, it works real well. For a county like Seminole, Osceola, Brevard, Lake, the media are like, what do y'all want to talk about? You don't really have Mayor Demmons there. You don't have the mayor, we're just going to, forget about y'all because, there's so many other counties and so many cities are like, we're not going to go there. So it didn't really work for us that well. So right now what we are doing is press avail. So if we're doing something like we're doing a vaccine clinic in a predominantly Latin Hispanic community, we'll do a press avail there. If we did a press avail a day because the age bracket lowered. So we did it right here in front of the pod. So if something's happening, we'll maybe do that. But the formal press conferences work real well for a large 2 million population county. But, 500,000 in our media market, they're like, tell us if it's going to be interesting and maybe we'll show up. And we find that they don't even show up. So it's not even really worth our while to do that. So even how we've done press conferences has totally shifted. It needs to be something that the media actually wants to come to. So we provide information as best we can. We do have a website, a specific, and I'm really blessed that the county years ago gave the emergency management the option of having its own webpage and own website. A lot of counties don't. It's buried down underneath fire or underneath the sheriff's office or something like that, and it's one page. We've been really blessed to have a preparedness website where people can go and get information, and we have lots and lots of information on there. Everything that you could possibly want is constantly updated. So those are the ways that we communicate, which is different than a hurricane. Some of the things are the same, but a lot of things are different. Hurricane, we plan on going back to the Facebook Lives and the question and answer period for, talk to the emergency manager and stuff like that. But not right now, not with this, not with the political climate.
Actually, I have a lot of questions too, Claire. So we're gonna have to like tag team. So this might also be most appropriate for Mr. Harris. I know you mentioned, the federal response, and we all know it was not great. And I've been watching that in combination with a lot of state preemption that's been going on, and I'm just wondering if that's something that you guys ran into here in Florida. Yeah, just that. Yeah.
So the state not having, so a lot of people got on to the state about why did you not have a comprehensive pandemic plan for the entire state of Florida. And partly I say it's okay that they didn't, because how people are reached in Sumter County is vastly different how people are reached in Seminole County, and vastly different than Miami-Dade County and the Keys. I mean, totally different communities, totally different ways that we communicate, really, quite frankly. I mean, a lot of people know each other in Key West. I mean, they live there, they know each other. They're like, they know, they just do. And in Seminole County is totally different than Sumter County. So we had a relatively good pandemic plan, and so did Sumter, and so did Miami-Dade, and so it's in a way kind of good that they didn't. Now, some counties didn't, and you saw that. And you could easily see that. I mean, you could watch the TV and see that they didn't really have a plan. If they did, I'm not sure why they didn't use it. Because if we're telling an 80-year-old with a cardiac issue that they need to sleep overnight to get a vaccine, that's not a good plan. That's not a very good plan. So, in one case, it's good that the state didn't have a very strong, you must do this. But in another case, maybe they, will probably come out of this and go, hey, while we're not going to tell you exactly what to do, you need to have these things and you need to think about these things when you're developing your pandemic plan. So there's probably a check and balance there. As far as the national, I think that we're seeing that come online pretty quickly. But it was quickly, it was pretty clear holistically there was no major pandemic response plan. In fact, we were told multiple times that it's going to go away in no time, and we're not seeing that. So, and I'm not really beating up any specific political party. It's just what was said. So, yeah, I guess that's, in one case, it's good that they didn't have you can't do a one size fits all for the different counties that are in the state of Florida.
Thank you. Interesting.
Deborah, Dr. Knox, any other questions?
It's Claire's turn. I just asked. We're going to keep going back and forth probably.
I would like to hear, Reverend Downey, if you could touch on this, far after, the EOCs deactivate and, hospitals return to normal or new normal, whatever that looks like. Your organization is likely going to see the fallout from this pandemic for a long time to come. So what can we do as emergency managers to help support our community partners? And what does that relationship look like moving forward?
Yeah, I thank you for that question, Margaret, because I do believe that is the truth, that our nonprofits are going to kind of be the people who will be on the ground for years to come, especially when we look at what the pandemic has done to our economy, especially here in Florida and around hospitality and tourism, which again is where most of our low wage workers are. And we don't know what it's going to look like in the future. We don't know, is tourism going to pick back up? And we've heard anything from, by the end of 2021, we'll be back to it'll be 2025 before we're back. The thing that I do know is true is I can look at the trends from 2001 and that how that affect tourism and economy, and then looking again at the recession in 2008 and what that looked like for tourism economy and how long it took to recover from those. Those are our only touch points for us to project on what the future is going to look like. And I can tell you that that future does not look very bright. In fact, it is almost devastating to think about how, if we do not as a community start really paying attention to what's happening with our low wage workers and what's happening with our housing crisis. We had a housing crisis before a pandemic. I think everybody knows that. We had been clinging and banging that drum for a few years. It kind of really started to tighten really, really tight in 2017 in Central Florida. By 2020, we had, a deficit of 150,000 units for people who were extremely low and low income in Central Florida. And so if you think about, we were already at a deficit, and think about what we have coming forward, when we think about when people start looking at their rents having to be paid again, if they haven't gotten their employment back, what it looks like for back rent, all of those things are coming. They're coming, and we don't really have any leadership around what we're going to do about them. Evictions are in the state of Florida. You have to pay all of your back rent before you can go to court. We call that pay to play when it comes to eviction status. And so we do have some counties who are working diligently when somebody comes up to court to use CARES funds and the new relief package funds to pay people's eviction fees so that they can go to court and be able to prove that they were unemployed because of COVID. So there's some hope in those types of programs. I would love to see more of those things happen. And I think emergency management if you think about, I know oftentimes homelessness is kind of, well, and maybe this isn't every county, so I'm just going to talk about my county, but when we have a hurricane, when we have something going on, people automatically start asking, what are we going to do about people who are experiencing homelessness? What are we going to do about people experiencing homelessness? I have news for everybody. Everybody is experiencing homelessness all the time, even when it's not a pandemic, even when it's not a hurricane. And we need to be asking ourselves what we're going to do for people experiencing homelessness all the time, not just in response to an immediate need, because it has already been an emergency and it will continue to be so until we as a community make it a priority.
Thanks for sharing that message, Reverend Downey. I think that's an important thing to highlight. So this is really a great opportunity. Charles, thank you for sharing in the chat box the information that you're compiling with the research paper. We're definitely interested in what comes from that. That's certainly a startling statistic to see for those of you who didn't notice the looking at where 85% of counties were not communicating COVID-19 information effectively. I see that there are a couple other folks on the call, so another opportunity for those who are participating to ask questions of our panelists. And if not if we don't have questions, I'd like to encourage Mr. Alberts, Mr. Harris, Reverend Downey, if there's anything that you really want to bring to the table in this conversation, please feel free to do so. Mr. Alberts, I see you went off mute.
The one thing that really bugs me about this whole response to this pandemic is the blended or blurred lines between public health and emergency management. And it's not just a local-based thing in a lot of instances, it's the state, but the federal government as well. And I think we really need to figure this out. What and why and how and all that. It just doesn't make sense with our traditional teaching. Even with a lot of the Department of Health having the CRI or Cities Readiness Initiative with bio preparedness efforts and having pod sites and drive up pods, and yet all that was kind of like thrown out with COVID-19. We started from scratch. So I just don't understand how a lot of things progressed. And I really believe that our nation, all the way down to the locals, have got to figure out who's doing what and how and why, because it was extremely confusing, at least to me, seeing it from this side.
So I have another question for our panelists. It would be interesting to hear, because this was recorded and it will be heard by students who are pursuing professions in emergency management. Aside from understanding the sheer force of will it can take to sometimes survive an incident, especially those that are long going like this one, what would you encourage students to focus on and to do to prepare themselves for a career in this field, especially post-pandemic? Open to anybody who wants to jump in on that one.
I mean, the interns right now are getting quite a lesson. I've been in this profession in emergency management, almost 21 years. And of course, never experienced anything like this. Certainly never. We used to have the longest running EOC activation during the state of Florida versus George Zimmerman trial. And that was 2 months. And I thought that was a lot. We are now at a year and a couple of weeks. So, I haven't even seen my office for a couple months. I have not literally walked into my office for a couple months. I hope it's still there. I think it is, but I just don't see it. I'm actually right now at a makeshift office in the old Sears at Oviedo Mall where we're doing vaccines. So sometimes I'm out here, sometimes I'm in the Emergency Operations Center. But what I would say for students is get experience. Find an emergency management office that is proactive, that is a leader, and you can ask your professor which ones are and which ones aren't. and find one that is, and you can learn an incredible amount, even in blue skies. When we say blue skies, we mean when there's not a disaster occurring. So you're going to learn a lot then because of trainings and exercises and the other stuff that we do. But during a disaster, you're going to learn a whole lot. And go back to Eric's, you'll when you look around the state of Florida, you can see the counties where the emergency manager and the Department of Health, emergency management office, and the Department of Health is connected at the hip. I talk more to my director of health than I do my spouse. I sometimes Donna I speak to when I go to bed, and she's the first person I talk to when I wake up. And you can see that in counties across the state of Florida. And you have to do that during disasters, whether it's a hurricane or whatever. I talk to a lot of people. So I would say to them, again, just get experience, get into the internship, learn how to deal with stress. I think Eric made an incredible message with that. You have to be able, if you're a person that can't deal with stress, this is not your profession. Pick another one. Do not go into emergency management. I'm not saying that it's stressful all the time. It's not. But you have to be able to deal with it physically. You have to be able to get away. You have to be able to take breaks. You have to be able to learn how to meditate and deal with these things. Otherwise, it will kill you. And I do it sometimes really good. And then sometimes, in December, I didn't do it very good. And I ended up at Eric's competition and the ER, so, that can occur, and you don't want to get in that situation. That's a wake-up call for us in emergency management. But I'll end with this, and that is, I love this profession. Emergency managers can make incredible, life-changing, and I mean the whole team, life-changing things that occur inside of the county. Our well check unit has called individuals that can barely breathe, and Eric knows how important this is. When an emergency room doctor calls you and says, "Hey, had you not sent the EMS crew over there, this lady would have died." For a doctor to take that happened over and over and over again. So you can make a difference. You can save lives. I see things that have, the emergency management office has done. We've had people here at the vaccine that have said, hey, you're Alan. And I'm like, yes, thank you so much. And this is the first time I've left my house, and I feel comfortable here. It's everything, but everyone's social distance, everyone. I love that. I love that about this profession, that we can make a difference. And if you don't mind a little bit of stress, this is a really, really cool profession.
Yeah, so I'll echo that. I love this profession. I'm extremely passionate about it. I think for me, you have to understand that you will continue to learn your whole life, or your throughout your profession in emergency management. You cannot expect that you're going to know everything and be a know-it-all. That's not how this works. You come in and learning, and you'll leave at probably the last day. Lord willing, I ever get to retire from this profession, the last day I'll probably still be taking a class or learning something. And the other piece of that is resiliency. I keep harping on that, but you've got to have a good support system around you. Okay. And emergency management is all about collaboration and coordination, but you as a person have to have a good backbone or framework around you too. You can't elaborate enough about how important really close friends and family are. And those, especially the ones that live with you, that you're able to go home and just hug and love and appreciate, and how much that matters. And they help you through the stressful situations. But, just like our jobs, you cannot think for a minute that you can do it all by yourself. It really takes an army. And there are other people that have got to support you behind you to help you, enable you to do your job. So those are my learnings and my thoughts.
Speaking of, I have a toddler who just ran into the room. I thought the door was locked. So if you hear him talking, that's why. I would say I'm not an emergency manager. I'm a clergy person and I run a nonprofit, but I do have a family member who was emergency management my entire college career. And so that meant I got to be deputy emergency manager because she knew I was a free volunteer. And so I do know very clearly what our emergency managers go through, just because watching her go through that. And I would say everything that's been said here around self-care and managing stress and those things are so important if you're going to go into emergency management or any other helping profession. Honestly, secondary trauma is a real thing. It isn't made up. And so when you are experiencing other people's trauma, and then if you have any kind of history of trauma yourself and those things are left unchecked, it will eat you up inside and it will hurt you. It will damage you. It can even kill you, as Alan said. And so, having no shame about getting support and help, seeking therapy has been one of the key things that has really helped me to be able to do my work well, is making sure that I have the proper support systems around myself to be able to do that. Meditation, also Alan mentioned, is such a great tool in this to help you disconnect and to begin to focus on yourself as opposed to thinking over and over about the things that you are experiencing or seeing. And then also just, putting a time for yourself, making sure that you are actually scheduling those things and doing them and not just saying you're going to do them, which we're all very guilty of just saying we're going to do them, but actually doing them.
Thank you so much. Thank you, all three of you, Reverend Downey, Mr. Alberts, Mr. Harris. I know that we're at 5:35 on a Friday. We're at the end of not just a busy work week, but as Mr. Harris said himself, a busy year-long activation. But I'm just truly grateful and appreciative of your time, the work you've done for others. And Reverend Downey, don't sell yourself short. You've become an emergency manager in your role that you play. And really just appreciate having representation from the nonprofit, private, and public sectors here on our panel today. I really look forward to the feedback we get from our participants and even our students who view this recording in the future. I just hope you each understand what a great value you've provided, not only to the conference, but to those who will watch this recording later. So with that, I believe that's left us in a really great position. Some great final comments from our panelists. I appreciate each and every one of you again for being here today. Stay safe and be well, and take care of yourselves and each other. Thank you.